Nye the Science Guy.
Wait. This isn't a Bill Nye episode. Growing up, we would watch Bill Nye the Science Guy, and I bet we all miss it. So I'm here to bring you nostalgia and remind you of your childhood by doing a spin-off. So here it goes. Today's episode 1, let's start with the Krabbe disease. And no, this disease is nothing related to crabs. Krabbe disease, a rare genetic condition, is an inherited metabolic disorder that leads to the accumulation of excessive lipids, fatty substances like oils and waxes in different cells and tissues throughout the body. This buildup results in the destruction of brain cells. Our degree in itself already destroys our brain cells, but let's dive into the depths of this disease even more. Krabbe disease, also referred to as globoid cells leukodystrophy, is characterized by the breakdown of the protective myelin coating of nerves caused by the presence of globoid cells, which are cells with multiple nuclei. Krabbe disease arises from a genetic flaw in the GALK gene, resulting in the dysfunction of an important enzyme called galactocerebrosides. This enzyme plays a crucial role in the metabolism of myelin, which is the protective substance surrounding nerve fibers. Galactocerebrosides especially are a class of lipids that are normally broken down by the body, but are interfered with the Krabbe disease. Galactocerebrosides, an enzyme necessary for the breakdown of these lipids, is deficient in this condition, which results in the impairment. These fatty substances consequently build up in cells and tissues all across the body, including the brain. Lipid accumulation mostly impacts the cells that create myelin, which is the protective covering that surrounds nerve fibers again. For the neurological system to work properly, myelin is extremely necessary. In Krabbe disease, the buildup of lipids causes the oligodendrocytes, which is the cells that result in myelin, to die. As a result, the transmission of nerve signals is hampered by myelin loss. Additionally, globoid cells with numerous nuclei are created as a result of the breakdown of myelin. These globoid cells also contribute to the degeneration of the neurological system and the harm done to nerve cells. This leads to symptoms such as severe deterioration of mental and motor skills, muscle weakness, hypertonia, which is the muscle's inability to stretch, myoclonic seizures, which is sudden shock-like contractions of the limbs, spasticity, which is involuntary and awkward movement, unexplained fever, blindness, difficulty with swallowing, and deafness. Typically, Krabbe disease is not well understood since it's a very rare disease and there is limited information available about it. The scarcity of cases make it difficult for doctors and researchers to gather knowledge through observations or extensive studies. Unfortunately, there is currently no specific treatment. In infants, the disease is typically fatal before the age of 2. However, individuals with the latter onset form of the disease usually experiences a milder progression and have a significantly longer lifespan. Well, that's not all that is stored for you about this detrimental disease. Let's dive more into the findings of this disease. Earlier, it was mentioned that in infants, the disease is typically fatal before the age of 2. In 2017, Dr. Matthew, Dr. Michelle, Mr. Anthony, Dr. Shilpa, and Dr. Maria from the American Academy of Neurology did a 15-year study on the developmental outcomes of cord blood transplantation for Krabbe disease. This study aimed to examine the long-term results of hematopoietic stem cell transplantation, also known as HSCT, in children diagnosed with early infantile Krabbe disease, specifically those who underwent the procedure within the first 7 weeks of life. Briefly, HSCT is a medical procedure where healthy stem cells are transferred into a person's body to replace damaged or diseased cells. These stem cells have the potential to develop into different types of blood cells, helping to rebuild the immune system and restore normal blood cell production. HSCT in Krabbe disease can rebuild the buildup of galactocerebroside, which can protect myelin. By preserving myelin, the transplantation of healthy stem cells may help maintain the proper functioning of the nervous system. In this study, there were 18 children, 11 girls and 7 boys. Their ages all ranged in less than 2 months of being born. The study included all babies with Krabbe disease who were referred to a research program for rare disorders. These babies were identified through newborn screening or diagnosed shortly after birth because they had a family history of the disease. The study only focused on babies who had received or were being considered for HSCT. The researchers looked at various factors such as brain imaging, protein levels in the fluid surrounding the brain and spinal cord, nerve conduction speeds, responses to visual and auditory stimuli. They also assessed the baby's motor skills, language abilities, and how well they adapted to their environment using standardized tests. The study went on from December 1999 to October 2015. The results were as follows. Of the 18 patients in this study, 5 died, 3 of transplant complications, 1 of surgical complication, and 1 of disease progression. 1 of the surviving patients had normal cognitive function and 10 continued to develop cognitive skills at a slightly slower rate than normal. All surviving patients continued to gain receptive language skills, with 7 falling within the normal range. 10 patients received speech therapy, and 2 of these patients required augmentative communication devices. 3 patients were able to walk independently, and 7 walk with assistive devices. Spasticity ranges from mild to severe, and 12 patients were orthotics. Brain myelination were stabilized in 8 patients, improved in 4 patients, and worsened in 1 patient. Overall, the surviving patients functioned at a much higher level than untreated children or symptomatic children who underwent HSCT. These results show that early HSCT changes the natural history of the disease by improving both lifespan and functional abilities. Although HSCT study provides class 4 evidence, which is the lowest level of evidence, it still has potential to be beneficial to Krabbe disease treatments. Collaborative efforts, which is combining HSCT with gene therapy, enzyme replacement therapy, or other emerging treatments, might enhance the effectiveness of disease management and improve outcomes of the Krabbe disease. Maybe one of us sitting in this room today can lead to the revolutionary idea of overcoming the Krabbe disease. And that is it for this episode, everyone.